Yes, Mr. Baswaraj.
Yes, sir. Now it is opening first slide, sir. Got it. Sir, can you start, sir?
Yes, Baswaraj, you can start.
Yes. A very good evening to all evening doctor. Thank you so much for. Sir, you make it. One, sir. Unmute. A very good evening to all eminent doctors. Thank you so much for joining the today's webinar, doctor. Today we are trying to spread the awareness of the rabies, which is the fatal, but it will be avoided with the proper vaccination. That is the initiative from the Cadila through innovation, the society and mankind, human mankind. The topic of the webinar, doctor, dosage reduction strategy and rabies management role in the novel vaccine. Dear doctors, the rabies, the first 3-dose anti-rabies vaccine with the great pride to like to introducing 3-dose anti-rabies vaccine. The rabies is successfully completed 1 year. The success day of the today we are on plan to make the webinar of this webinar, sir. We are with more than 40,000 animal bite victim being the vaccinated 100%, complaints with record and no cause of ADR was registered. With this, today I are honor introduced to speaker of today webinar, Dr. Milind Halgekar, the pediatrician, leading pediatrician of the Belgaum, and our honorable moderator, Dr. Anand K. Bandurge, is also present here. Now I hand over the session to Dr. Anand K. Bandurge, sir. Can you talk about Dr. Sir Milind Halgekar? Thank you, sir. Anand, sir.
Sure.
Yes.
I'm here.
Yes,
Can
sir.
you hear me?
Yes, sir. This you had the hand of the session is handed out to you, sir.
Okay. Thank you so much. Thank you, Cadila, for giving me this opportunity. A brief introduction regarding today's speaker, Dr. Milind Halgekar. He is a very popular pediatrician of Belgaum, practicing pediatrics for the last 28 years. He has graduated from Government Medical College and is a recipient of gold medal in DCH. He has successfully served as a president of IMA and IAP Belgaum in the past. He is also attached to Malaysian College of this one Medical College of KLE in the Department of Pediatrics. Now I request Dr. Milind to take over.
Yeah, good evening, everyone. It's so nice to be associated with Cadila. Yes. I thank all the representatives and
Audio issue.
the new innovative. As you hear, can you
Audio
hear,
issues there? Not
Yes,
able
sir.
to hear.
Yes, sir. Sir, Milind, sir, you can make your video off and then we can able to listen you properly, sir. In that case.
Video
Yes, sir.
of the video. Video is off. Video on. Yes. No, he said
You
to
can-
off it off the video. Off the video. Can you hear me now?
Yes, sir. We can hear you.
So first of all, I thank Cadila company and the representatives and the office bearers of this company, the managers, for giving me this opportunity to be with you this evening to discuss about new rabies vaccine, innovative vaccine, the first time in India. So let's go ahead with this topic. You already know that the association of human beings with dogs has been since many, many ages. And it is rightly said that dog is the best friend of a human being and a best companion. But along with it, it is the disease which is transferred from particular surviving from this is impossible. Thank God help us to counter this particular fatality of this disease. It's a vaccine-able disease thanks to all the inventions and these inventions of this particular vaccine. And rabies is one of those innovation vaccination is help and to survive from this particular fatal disease. So first of all, let's see what we are going to discuss about in this particular session.
I think sir has a network issue. Baswaraj. Hello. Baswaraj.
Can you hear me?
Hello. Hello.
Yeah, I can hear you, sir.
Yes, sir. Sir, I think you have a network issue. Shall I share the slide, sir?
Yeah, absolutely, absolutely. That will be better, I think.
Yes, sir. Hello.
Can you hear me? See, rabies basically is a zoonotic disease spread by dogs, cattle like buffalo, cows, then even the rats. No, it's not rodents, but the cats, the bats, and the wild animals like wolves, foxes, etc. But most of the times, it has been seen that 96% of this particular disease is transmitted by dogs itself. So rabies is caused because of a neurotropic RNA virus, Rhabdoviridae. And usually it has been seen that in the Western countries, the bats are also responsible for transferring of these diseases. Human to human transfer is not yet recorded, but the organ transplantation has been responsible for transferring this disease from humans to human. So let us see about this particular virus, how the structure is. Basically, it has got 5 structural proteins. Most of the one of them is N protein, that is the nucleoprotein, phosphoprotein, L protein. Then other one is the G protein, matrix protein. These are the 5 structural proteins. Of them, 2 proteins are very important. One is the G protein. That is the glycoprotein, which is very important when it is concerned with the development of vaccines. The immunoconversion by this vaccine, the immunoprotection totally depends on this particular G protein of this virus. The next slide. You're going to share the slides. So when you come to and see the epidemiology, around 59,000 rabies deaths are seen per year globally. And you'll be surprised to know that 20,000 of these deaths, rabies deaths per year, are in India. They account for around 35% of deaths globally and 60% of deaths in Asia. And unfortunately, 91% of these deaths in India are seen in the rural areas. And as a pediatrician, I feel very sorry that more than 50% of these deaths are in the children. So you can understand how important it is to control and prevent these particular deaths in our country. When it comes to the states, UP has the major chunk of deaths. Then the eastern part of India, like the Andhra Pradesh, Orissa, West Bengal, Chhattisgarh, Madhya Pradesh, these states also contribute a lot for the deaths of these patients because of dog bites. And fortunately, there are a few states in India which do not have deaths because of rabies. First is the Kerala, then the Union Territories, Daman, Chandigarh, and other states. Luckily, the deaths in these particular states is very, very less. Maybe the education level in these particular states is far more, and the awareness about this disease is well transferred to the citizens of these states. So, as you see in the slide, rabies is certainly 100% fatal. I don't think anybody has survived after the symptoms have started in this particular disease. And fortunately, I thank the researchers, the scientists for developing all these vaccines, and these vaccines have made this disease 100% vaccine preventable disease. Next slide. Before this slide, just we will discuss about this particular disease. See, this particular disease, after a bite, the incubation period of this disease varies from 5 days to years, usually 5 to 6 years. Some cases have been recorded where the disease has been seen after about 15 to 20 years. So the incubation period is not certain, but most of the times it has been seen. It depends upon the age of the patient, the site of the bite. See, the site of the bite is on the head neck area, or the area where the innervation and the nerve supply is very rich, like the tips of your fingers, the perineal regions, the upper limbs. Then the incubation period is less. In children, the incubation period is less. So usually it is around after the bite, the incubation period up to the seeing of these symptoms, it is around 1 month to 3 months. And in the early period, there is a prodromal period. It's like any of the viral infections, fever, headache, lethargy, body ache. These are the things which are seen after the bite. And certainly the contamination, the depth of the wound and contamination with the saliva is also very important. If it depends upon the category of the wound. If the category 2 and 3, in case of 2, the chances of infection are less. And also the care what is taken after the bite, the washing of the wound. It has been seen that thorough washing of the wound by a detergent soap for around 10 to 15 minutes in flowing water reduces the amount of viral load at that site by around 50%. So the infectivity of this particular disease also depends upon the what care you take after the wound and the site of the wound. Now, how the disease transfers? So as I already told you that the infection is because of a virus which is neurotropic. This particular virus likes to dwell and multiply in the nervous system. From the peripheral nerves, it goes to the spinal cord. From the spinal cord, it goes to the brain. And in the brain, there are certain areas which these particular viruses like to stay and multiply. These parts are basal ganglia, hippocampus, thalamus, hypothalamus, these areas. And after multiplication in this particular area, then from the sympathetic and the sensory nerves, it goes to various glands and the eyes. And then it goes to the salivary gland, and from there it multiplies and that becomes a site from where the transfer of viruses propagates from that particular salivation and the saliva. And now let us see how the patient presents in this particular disease. There are two types of presentation. One presentation is a curious, we call it a curious presentation, and the other presentation is a paralytic presentation. When we think of the curious presentation, classically we see three things. One is hydrophobia, one is aerophobia, and third is photophobia. You must have seen many patients, at least I have seen not less than 10 patients, that two children when I was working in hospital, we used to have a lot of patients of hydrophobia at that time. And the classical presentation was the patient at the site of food, at the site of any fluid, most probably the water, they used to have spasms, and these are very painful spasms. Even it is just like choking for them. So even the noise of water falling outside, even the sight, even somebody is drinking water besides also initiates these particular spasms. It's very, very frightening sight to see this. We have seen these things and we feel very pity about these patients, but we can't. We are totally, as doctors, we are helpless. Even a slight wind going around in the room or the fan on in the room also initiates these particular painful spasms. These are pharyngeal and laryngeal spasms. And if you blow on the face, this is the typical presentation. If you blow on the face of the patient, he suddenly will have severe spasms. And clinically, it is very easy to diagnose this particular disease. Then again, one other presentation is of photophobia. And even the sight of the sunlight also triggers the spasm in this particular patient. So you understand, you can't eat food, you can't drink, you can't tolerate sunlight. So the basic needs of life are taken away from this poor patient. And certainly within 4 to 5 days after the symptoms start, the patient succumbs to this particular virus. So this is the classical presentation of hydrophobia. Another presentation of this particular disease is paralytic. You must have seen a case of Guillain-Barré syndrome. This is an ascending type of paralysis which we see after any post-viral infection. Then there is ascending paralysis of the muscles. The patient is unable to move. Then the respiratory muscles are affected. There is hypoxia, hypotension, coma, and death. This particular presentation is seen in patients where the patients are partially immunized for this particular disease previously. 1 dose, 2 doses, somewhere here and there, and then they have left that particular schedule. So skipping of the schedules and the previous 1 or 2 vaccinations some many years back, these patients certainly have presentation in this as these patients. And here the death is a bit prolonged. The patient, after the initiation of the symptoms, dies after 2 to 3 weeks. So this is the difference between the presentation of this particular rabies in these 2 formats, the classical furious format and the paralytic format. Then regarding, you should know about the treatment or the prevention of this particular disease, which is very, very, very important. First and foremost is cleaning of the wound. First is categorization of this particular bites. The category 1 is like handling the dogs, feeding them. This is the category where you did not give any treatment. The second category is small scratches. There is no bleeding. Small scratches or leaks of the mucosa and contamination of the mucosa or the saliva of the dog on your skin, which is intact skin. This is second, not intact. There is some abrasion on the skin, but it's not bleeding. The third category is there is bleed because of the bite or scratch or even the because of the nibbling. So these are the 3 categories. In first category, you need not do anything. In the second category, thorough cleaning of the wound with detergent soap. In our case, we can say we can use a Rin or any cloth washing detergent to be used there. After cleaning it for 10-15 minutes in flowing water, then you have to apply povidone or iodine preparation to it, which is Biricidin. After that, as I told you before, that 50% of the viral load is reduced just because of thorough cleaning of these wounds. Then the post-exposure vaccination is important. After this and in case of a third category, here it is compulsory to do the passive immunization, which is the immunoglobulins, the rabies immunoglobulins, whether they are human or equine. Whatever is available, we have to give it. As per the dosage per kg, we have to calculate it, and we have to inject as much of this immunoglobulin at the site of the bite, because it neutralizes the viruses at that site and inhibits the virus to enter into the nervous or the peripheral nerves and go ahead towards the brain. So we have to stop the viruses propagating and transferring from these nerves ahead above. So, and in case if the wound is very big and the amount of immunoglobulin which you have to inject is very less, you can dilute it 10 times with normal saline and you can give around the wound. As far as, and sometimes what happens, there is a lot of bleeding because of these wounds. Then you will have some problems, see how to give, whether to suture this wound or not. See, as ideally, no suturing of bites pythons. But sometimes when it is very necessary to suture, see to it that first of all, the immunoglobulins are injected in the wound and then they are sutured. So always remember to inject the immunoglobulin and then suture this particular wounds. So this is about the how now you will come to know, you will have a confusion whether this is a category 1 bite or it is a 2 by category 2 or category 3. If you want a comparison of this, just use a bit of alcohol and put it on the side. If there is burning sensation or some pain, it is category 2. If there is no burning, it is category 1. And if there is blood seen in the wound, it is category 2. So for category 3, giving immunoglobulin is compulsory nowadays. Nextly, this is about the treatment of the prophylaxis or prevention of this particular bites. Now let us see. We would like to see the vaccines, the stages of vaccine. Can you, sir? See, now we have got, now when you go to the history, we should thank Louis Pasteur for inventing this particular vaccine. It was in late 1885. It was a neuronal vaccine, living attenuated vaccine, which was derived from the spinal cord of the infected animal. And this was a neuronal vaccine, and it was developed, but unfortunately, it had many side effects. Most of the side effects were concerned with the nervous system, and even they had seen deaths after vaccination of this particular neuronal vaccination. Then it was in 1885, then another 2 years, then another 2 vaccines, and that too were of neural origin. They too had a lot of side effects. And unfortunately, those vaccines, they used to give 14 intradermal injections. And I remember in my family, my brother had a bite and he used to go to the civil hospital to take these injections. And it was a hell of a time to take him to the hospital and give those 14 injections, very painful injections. And I am certain that nobody will complete that schedule of 14 injections nowadays. So that was then the second phase came with non-neuronal vaccines. That is the second stage. Then the origin from the cells. Cell culture vaccines were developed in the third stage. And now recent technology has come out with DNA, recombinant DNA technology, where production of vaccination has grown, and there is nowadays no shortage of this particular vaccines. But unfortunately, the DNA recombinant vaccinations, when you see the efficacy, it is still not up to the mark. So we still need to go ahead in our inventions and see that the efficacy is more in the coming vaccines. And here in this DNA, recombinant DNA vaccine, the schedule is for 5 days, 0, 3, 7 days, 14 days, and 28 days. Next slide. Now, you see, these are the current challenges. These are age-old technology which has been used. The inconsistency in the potency of this vaccine is seen. Stability is not yet up to the mark. And because of the short supply, we are unable to control and prevent this particular disease. And still, undoubtedly, the adverse reactions have come down drastically. But even then, the adverse events still remain, and here and there we have some anaphylactic reactions, allergic reactions, headache, malaise, body ache, ear pain. These adverse reactions are still there. Now we need to come down with the schedules, which is 5-day of 5 injection schedule, which goes on for a month or so. And some innovative inventions have been done by Cadila, and the schedule has been reduced to within a week. So certainly, the shortening of this schedule is going to help in the compliance of taking this vaccine by the patients. Next. So when you, as it has been shown in this particular study, as the schedule of this vaccination goes beyond 3 injections, the compliance from the patient goes on dropping. So multiple studies have been done here with 5 injections and 4 injections. It has been seen that 60% of the patient drop out from these particular schedules, and certainly it affects the compliance, and we are unable to give sufficient protection to these patients. And there are many other factors where there is non-compliance. First of all, the education and knowledge about completion of this particular schedule and the aftermath of discontinuing this has not reached to the general public. They are unaware about the after effects of discontinuing this particular schedule within 1 or 2 injections. The other thing is the financial constraints of these particular injections. Many are unable to, as I said, 90% of the deaths we have seen in the rural areas. So the financial matter comes into the play. They are unable to afford this. Nextly, the access to the health facilities. They are in the remote areas. They just don't care about what has happened. They don't approach the doctors or the health workers, and they do not get vaccinated, and that even gets delayed. So that is another thing. Then regarding the pain, regarding the follow-up, see, if the patient takes a vaccine and goes off, it is the duty of the government or the PSC or the private hospital to remind him about the dates. He should be given a card stating the next dates, not the, and number of telephones and messages should be done, which has not been seen even now. So reminding and follow-up is very important that we are lacking this particular health system nowadays. Next. Even pain is another cause, the needle pricks, and the fear of injection and the side effects. Now the internet shows them what are the probable side effects of these vaccines, and certainly very rare side effects are read by the patient, and they don't turn up for the rest of the vaccine. This is another cause of it. Now, the new vaccine has been introduced by Cadila. Is a wonderful vaccine, and thing is that a new technology, a nanotechnology has been applied, and a single subunit vaccine has been developed from the G protein of the virus. It is very important protein for immunoconversion. And virus-like particles platform has been used here to produce this particular vaccine, and it imitates the virus proper, but without any genuine and causing the side effects or the infection proper. And the other most important thing in this particular vaccine is it is equally seroprotective just by 3 injections, as effective as the gold standard vaccine which have been declared by the WHO. It is at par with these vaccines which have 5 doses injection. So, and other thing is that you need not reconstitute it with the solvent. It is directly in the liquid form, and it is painless, and it has very less side effects, no anaphylaxis, no deaths, and no serious side effects have been seen because of this vaccine. So here on this particular slide, you can see how it is produced. This is the idea native virus, and here on the right side you will see the particle, G particle without the genome into it. The G protein, this G protein, with the help of the nano engineering, this has been cultivated and the vaccine has been developed, a very safe vaccine, and it does not contain the viral genome into it, and it is capable of inducing very strong seroconversion. Next. So, so this particular study has been seen in this particular journal of Association of Prevention and Control of Rabies, very reliable and very famous journal, and this has been seen in this particular magazine. And next thing. We are going to see the clinical phase. This is the phase wherein there were 4 arms where the value has been given to 10 micrograms and 50 micrograms. And 2 types, 2 schedules were utilized there, the 2-dose schedule and the 3-dose schedule. And along with it, the gold standard Rabipur, where there were 5 injections of the schedule. The study was done, and the seroprotection data has been shown on the right side of this histogram showed that at 14 days, the seroprotection titers were 100%. You can see here all the vaccine in 4 arms here with the rabies and the gold standard rabies, they show equal seroprotection in their studies, and so it can be concluded that the even smallest amount of 10 micrograms in it and 2 dosage schedule can also produce the same seroconversion at 14 days and 42 days also. So even the phase 3 study has been done to just show that it is equally protective and the seroconversion is at par with the recent vaccines, and even the 3-dose dosing schedule can give rise to the same amount of seroconversion, seroprotection, and the side effects when you compare it with the gold standard vaccine, they are comparatively less than the gold standard vaccine. The phase 3 year vaccine. The basic aim of this particular study is to evaluate immunogenicity and safety of rabies G protein vaccine administered as a simulated post-exposure immunization in healthy volunteers. It's a randomized comparative controlled multi-center study with 800 subjects. It was randomized 2:1, 2 were of the rabies and 1 for the gold standard rabies vaccine. So here, 1 regime of 5 injections, and the 550 subjects were given the 3-dose schedule. That is subject with zero protection at 14 days post 4 days, it has ideally the zero protection of the rabies neutralizing antibody that needs to be more than 0.5 for it. The second objective is subject to zero protection at day 42 post 4 dose test vaccine safety level is subject to adverse. Here we have to see whether the zero protection titer exceed this particular 0.5 score level, and we have to compare the side effect because of this vaccine and the gold standard vaccine of WHO. When you see the histograms here, there is a very light slide difference of the zero protection comparison here at the day 14 and 42. The blue one is of rabies, the pink one is of this gold standard vaccine. Hardly there is some difference in both the things. Here it is the rabies is more, and 97 is of the rabies. Here after 42 days, a bit less of zero conversion efficacy is seen here in rabies, and this comparison is very insignificant and not really taken into consideration. So the safety is at par with the gold standard of WHO. When you consider the adverse events here, in case of green rabies, yellow is of rabies. The adverse reactions here in case of rabies are far less than the gold standards. If you see the fever graph is high in case of the gold standard rabies. So it has been proved beyond doubt that the side effects of the adverse reactions because of rabies are far less than the gold standard WHO vaccines. What are the conclusions here? Rabies is not inferior to the tetanus vaccine. It has less adverse side effects compared to the tetanus vaccine. Third is the novel rabies vaccine, where you have only 3 doses, which schedule completes within 1 week. When you compare it with the 5 doses, it is at par with the zero protection to the gold standard vaccine. Because of this innovation, Cadila has got 2 awards: the Pharma Innovation Award of Industry 2023 by the Economic Times and the Golden Global Tiger Award by Malaysia government. So really, they have done a great job by this innovation and reducing the amount of days and saving a lot of money and time when it is concerned in post-exposure vaccination. With this conclusion, I think.
Yes, Mr. Baswaraj, over to you.
Sir, thank you, sir. Thanks for giving the brief information about the rabies, sir. Some doctors dropped some queries in the drop box, sir. Sir, that is, sir, what their docs are. Symptoms of the rabies in the human, sir. Dr. Rajsekhar Mulimani is asking the question, sir.
What do you want? The symptoms.
Sir, there is one question received from one of the doctor, which Baswaraj is repeating. Mr. Baswaraj, आप जरा फिर से repeat करना question.
Yes, sir. Sir, what are the major symptoms and signs about the rabies in the human body, sir? Dr. Rajsekhar Mulimani, sir, is asking the drop their query, sir.
Can I answer that?
Yes, sir. Yes, sir. Hello, Dr. Milan. Hello.
Audible, sir. Audible, sir.
Milan, sir. Anand, sir, am I audible?
Yeah.
I
Yes, sir,
think
you are audible, sir.
Sir has a network issue, I believe.
I'm able to hear everything. Can you hear me?
Yes, sir.
Yeah, I think is that like any other viral infection, the prodromal phase will be seen after a few days of the bite, like fever, headache, nausea, body ache, and pain at the site, reddening at the site. And after the incubation period, which can range from 1 month to 3 months, then the symptoms of this particular disease is classical symptoms, signs and symptoms. When I told you that the agitation phase or the furious phase, it is most of the time 90% of the patients who present with this particular presentation of furious phase, and only hardly 10% with the paralytic phase. Aerophobia, then hydrophobia and photophobia, the classical signs and signs seen in this particular patient. I hope I have answered the question.
Yes, sir.
Yeah, sir, one more question is Dr. Sridhar Chikalkar is asking, sir, what are the advantages of 3-dose anti-rabies vaccine like TH rabies, sir?
First and foremost thing is that compliance. As already the studies have shown that as the schedule goes beyond 1 week, beyond the 3 vaccines, the compliance drops 50%. So here in post-exposure vaccination, where you want to control and prevent this particular disease, compliance plays a very, very important role. The other thing is financial matters. Most of the times they discontinue it because of the financial constraint. They can't afford 5 injections. So the financial things, the number of visits to the doctor, saving of time, and completing of this schedule within 1 week plays a major role in compliance and completing the schedule, which in turn gives more and more reliable protection against the infection of this rabies virus. Is it clear?
Yes, sir. Yes, sir. Basuraj, you have any question, Mr. Basuraj?
Yes, sir, one more question, sir. Sir, other than the dog bites, sir, which dogs, which animal bites are the very harmful about the rabies, sir?
See, I have seen one case of monkey bite having rabies. One cat bite having rabies. Raccoons and even buffalo bites I have seen having rabies. All cattle, even lion bites can give you rabies. Bat bites can give rabies. Any animals around you except rodents, squirrels, rats, they don't give rabies.
Okay.
Even pigs can give rabies.
Okay. Mr. Basuraj, any other question you received?
Yes, sir. These are I got the questions, sir.
I got one more question. So, sir, there is question from one of the participants. So, the question is that if a dog is vaccinated and after the vaccination of a dog, still the dog bites to a person. So, in such situation, what the person should do? Is he go for a vaccination or is he wait?
It depends upon the category of the bite. If it is the grade 3 bite, it should be treated as per the schedule. Immunoglobulin, because you don't know, you're not the vaccination status of the dog can't be checked by laboratory wise. You don't know which kind of vaccines and the schedule was complete or not. So it's a totally non-reliable thing. Even if the dog has been vaccinated, it is better to give 2 vaccines. 2 vaccines, 0 and 7.
Okay, sir. Okay, Mr. Basuraj.
Yes, sir. Sir, thank you very much, sir, for your grateful, motivating information, sir. We are truly appreciated for your efforts and would like to very thankful to Dr. Milind Halgekar and Dr. Anand Bandurge, sir. Sir, the Deshmukh sir, is
So,
kindly, sir.
Mr. Vasuraj, before closing the session,
Yes.
Anand sir, we also would like to listen from you, sir, in case of a
Yeah.
Thabis as well as sir. Yes,
I
sir.
want to add
Yes, sir.
something.
Yes, sir.
It need not be a bite only. It can, this rabies can be caused by droplet infection also.
Yeah, aerosol infection, there have been some cases.
Yes, sir. Truly right, sir.
A stray dog,
very rare.
rabid dog, if it is moving on the street
Mhm.
and its saliva is dripping down,
Yes, sir.
so even that can cause, it need not bite us.
Yes, yes.
The
It only like
incidences
a-
are very less.
Yes.
I think Milind has highlighted, I think.
Yes, aerosol is also.
Ah,
there,
aerosol,
sir.
yeah.
Thanks for adding, sir. Yes, I had missed that particular. Aerosol infection is this.
Okay,
sir-
thank you so much.
Sir, I would like to thank to you as well as Milind sir, because Milind sir, specifically you, sir, the way you have explained everything about the sign and symptoms, after that the chronology of a vaccine, how it is invented, how exactly it has been done. That was a marvelous, sir. It was a very deep session which you have taken, sir. Beside that, definitely with the experience of Dr. Anand, who has been there from last 43 plus years in the industry and serving with serving with his daughter as well as a son-in-law, also
Yeah,
entire
yeah.
family is there.
It
So
was
definitely-
certainly a opportunity
definitely.
for me to see him on the screen, such a respected
Yes, sir.
senior person on the screen. Really, I was honored that he introduced me.
Oh, thank you
so much,
so much.
Yes. Because our entire family of Dr. Anand is serving to humanity, and that is a very grateful thing, sir. And definitely, sir, Dr. Anand as well as Dr. Milind, definitely in the coming future, sir, there will be a more webinars on Fabis as well as a other set of products which we have for Cadila. So thank you so much for to all of you as well as the other people who have joined, all the participants who have joined for this webinar. Thank you so much, sir. Thank you very much.
Thank you, thank
So
you.
nice, sir. Thanks for giving me this opportunity. Thank you so much.
Thank you, sir.
Thank you,
sir.
Milind.
Bye, sir.
Thank you, sir.
Bye.
Hope to see you soon, sir.
Yeah, sure. We'll meet personally.
Certainly. Thank you, sir.
Bye.
Thank you.
Happy? Really?
Very nice. Because only 2 days ago.
Wow, 1 day.
5 days. Within 1 day, it is discussed.
Really? But I had decided I should do it.
Very nice.
Understood, man.
Yes.
Next time also we are informed when you conduct webinar, you require some proper answer.
At least.
Yes,
See the person who had done the study, so nice. With all slides. They are all researchers, no doubt. I am not a researcher, but if I get those slides, I would have done far more.
Thank you, sir. Thank you.
Thank you so much. Can I get the recording?
Yes, I will ask. I will inform to my superiors. They will send. It is already recorded. It records. We'll collect and at least support the exams.
Yeah, absolutely.